Are you having trouble in having baby? Nearly 27.5 million couples in India actively trying to conceive suffer from infertility. Cherish your dream of parenthood with us, Janitva IVF Center. Now we are in your city, Shillong.
Okay, doctor, so we are here to talk about fallopian tube block is a very common symptom in female infertility. So what do you think, doctor, actually happens when the fallopian tube is blocked?
So good evening. So fallopian tubes are very important site of fertilization of union. I mean the union of the sperm and the egg occurs in the fallopian tubes. So if one or the both tubes are blocked, there is no place to get united for this egg and sperm in the female body. So actually the pregnancy is not possible if the both tubes are blocked. And the main reason of fallopian tube block, we could see that the infections, mainly tuberculosis, is the most common cause of female infertility, the tubal block I mean. And followed by this, so many bacterial infections are there, chlamydial infection, and then the, other infections also. So, but in Shillong we are seeing that the tuberculosis is the most common cause of fallopian tube block.
If that's the reason, is pregnancy possible, doctor?
Actually, to get pregnant, one tube is sufficient. So, if one tube is blocked, the patient can try with her second tube if that is open. But if both tubes are blocked, we need to find a solution to either open the tubes or to go for IVF actually, because there will be no place to get fertilization inside the female body, because as I have told earlier that fallopian tube are the main site of fertilization. Yeah. So but if one tube is only blocked and the other tube open, then surely they can try for a pregnancy.
Is there any treatment for the fallopian tube blockage?
Yeah, we can go for tubal surgery. It's we do with pinhole surgery laparoscopically, where we do certain procedures like cannulation of the tube. We put certain wires inside the tube and we try to open them up, and they are very pretty successful in some cases. So there are different types of block actually. In the Cornwell block, where the corners of the tube are blocked, in those cases we get very good success rates in tubal surgery. But if tubal surgery is not possible or we couldn't open the tubes in surgery, then we have to go for other options.
What is the best solution or the best option we can take, doctor?
If surgery is not possible, then the only option would be the IVF, in vitro fertilization IVF, where we take out the eggs from the female body outside, we fertilize them with the husband's sperm, make the embryo outside, and then put them back into the uterus of the female body. So that the union part where it occurs in the tubes will be done by us. So that is IVF only. In vitro fertilization means the fertilization is done outside. So that will be the best option if surgery is not possible and the both tubes are blocked. And the young females, we get a very good success rate in tubal block in IVF. We get a very good success rate in IVF.
Is it very common? How successful is the treatment among the women here?
Yeah, most of the cases we have seen here, I'm talking about Shillong, is very common tubal block. And I've told you earlier, the tuberculosis is very prevalent, I think. So it's a common cause here in Shillong. And yes, we have very good success rate in young females. Actually, the patients are mostly young in tubal block. Okay, they are mostly young, below 35 years.
You said that tuberculosis is the main cause of female infertility or of the fallopian tube blockage. But then what about the women who have not suffered from tuberculosis? Are there any other diseases that they might have suffered from this?
Yeah, any kind of bacterial infection. We call it pelvic inflammatory disease. Among the bacterial infection, the chlamydia infection is very common. So any kind of infection can go through the uterus and tubes and can block the tubes actually. Yeah, infection is the main cause of tubal block.
So thank you so much, doctor, for giving a very clear view and understanding about the fallopian tube blockage, which may also cause infertility among women.
Thank you so much.
Consult Dr. Arpita Sharma, Chief IVF Consultant, Janitva IVF Center, Guwahati. For further details, please contact www.janitvaivf.com or contact Janitva IVF Center, Shillong.